Hi students, good morning all. We are talking about torch infections. Last class we had a discussion about toxoplasmosis. Let us move on to the next topic. Look at these two pictures. Picture of two newborn babies born with some sort of severe congenital malformation. Do you know what is this condition? About 1 lakh infants are born with this kind of congenital abnormalities. 1 lakh infants in each year. And the name of this condition is congenital rubella syndrome. The most common congenital abnormalities seen nowadays. Our today's topic is rubella in pregnancy and congenital rubella syndrome. You may have learned about rubella in your medicine classes. What is rubella infection? The word meaning of rubella is little redness. The disease otherwise known as German measles. Generally, it is an infection caused by a virus. It is a mild illness during childhood. Usually, it is a mild illness during childhood, and most of the time, it is asymptomatic. But when a woman is infected with rubella virus in early pregnancy, she has a 90% chance of passing the virus to the fetus, and it will result in congenital rubella syndrome, a most dangerous condition. Congenital rubella syndrome is an important cause of severe birth defects. It may also result in death of the fetus or abortion. First, let us see what are the symptoms of rubella in non-pregnant stage or in general population. Rubella or German measles. As I said earlier, it is less important in non-pregnant state. It is a mild infection and most of the time it is asymptomatic. But it is the most common teratogenic infection. Teratogenic infection means the infection which causes congenital abnormalities in fetus. The common signs and symptoms of rubella in general population is sore throat, rashes, low-grade fever, enlarged cervical and occipital lymph glands. Rashes and enlarged lymphadenopathy are the peculiar symptoms of German measles. But if a pregnant woman get an infection of rubella during early pregnancy, it will become more dangerous, and that will result in congenital rubella syndrome. It is characterized by sensorineural hearing loss, heart diseases, and cataract. And the chance of congenital rubella syndrome is more if a pregnant woman get infection during first trimester. Although the mother show little signs and symptoms, the fetus is affected very severely, and the newborn has the signs and symptoms of congenital rubella syndrome. The triad of congenital rubella syndrome consists of sensorineural hearing loss, cataract, and cardiac malformation, congenital cardiac malformation, mainly PDA, patent ductus arteriosus. It is also associated with neurological defects, growth retardation, thrombocytopenia, and blueberry muffin lesion. So it is very important to diagnose this condition in pregnancy. Early diagnosis will save the life of both mother and the fetus. How can we diagnose rubella? It can be suspected in a contact history. If the pregnant lady has a contact history with rubella, we have to suspect this case, and if the mother is non-immune, then suspicion is more. Rashes and lymphadenopathy are the most characteristic features of rubella. And regarding lab diagnosis, we can detect the rubella IgM antibody. Presence of rubella IgM antibody indicates a recent infection, or fourfold increase in rubella IgG antibody. The normal level of IgG antibody indicates past infection or immunization. If IgG antibody increases to fourfold, that is also an indication for active infection, or the presence of IgM antibody is an indication of active infection. The disease can also be diagnosed by rubella culture. It is done from blood, nasal discharge, or throat swab. Diagnosis of a congenital rubella syndrome is also very important. We can suspect this condition from the clinical presentation. We already discussed the triad of clinical presentation, and the presence of IgM antibody and the fourfold increase of IgG antibody is the laboratory investigation. If a newborn show IgM antibody of rubella, definitely it indicates an active infection, because IgM antibody does not cross the placenta, but IgG antibody will cross placenta, and it will be detected in infants up to 9 months. So it is said that if mother is immune and the infant get the infection immunity up to 9 months. That is why the immunization against rubella is given after 9 months. Regarding the management of rubella and congenital rubella, in non-pregnant state, rubella is a mild infection and it needs only symptomatic treatment. But if detected during early pregnancy, there is a high chance of congenital malformation, so medical termination of pregnancy should be advised. It is better to abort the pregnancy, and the newborn babies of a suspected mother should be screened for this condition. The newborn should be screened for eye, ear and cardiac abnormalities. The most important part of the management of this deadly disorder is the prevention of this condition. Very effective vaccines are available nowadays. So here what we can do is to prevent the diseases by active immunization. It is included in National Immunization Schedule as MR vaccine or MMR vaccine. MR means measles and rubella. MMR means mumps, measles and rubella vaccine. In some states MR vaccine is given, and in some states MMR vaccine is given, and it is given at 9 months. The reason I have already mentioned earlier. If not given during pregnancy, adolescent girl should be given the vaccine. Nowadays Government of India advocate this adolescent vaccine for all adolescent girls. After the introduction of this vaccine, the rubella cases and congenital rubella syndrome is decreased dramatically. Earlier, this disease rubella was an endemic disease, with epidemics occurring every 6 to 9 years before the introduction of vaccine. Today we are living with another endemic era, that is COVID-19 endemic era. Similar endemic outbreaks occurred in the world earlier. Outbreak of rubella endemic was one among them. In 1964-1965, before the development of vaccine, a rubella epidemic swept the United States. During this period, there was 12.5 million cases of rubella. 20,000 children were born with the congenital rubella syndrome during this year only. Then vaccine was discovered. The first rubella vaccine was discovered in 1969. After the introduction of rubella vaccine, the case was decreased dramatically. But even today, it remains as an epidemic in certain countries. Rubella is eliminated in many countries, but continues to be endemic in many parts of the world. It is estimated that more than 1 lakh infants worldwide are born each year with congenital rubella syndrome. This is the brief outline about congenital rubella syndrome. It is an important short answer question, so please read it carefully. Thank you.